future of healthcare has arrived. Artificial intelligence and machine learning are transforming the practice of medicine and improving patient outcomes. This is Smarter Healthcare with AI. Conversations with Dr. Hassan Tetteh as he shares insights into the healthcare of tomorrow and how we can help create it today.
I'm back with David Sontag. We've been discussing how Lair Health's approach to AI for healthcare differentiates it from other companies and how their products can improve patient care and healthcare operations. So, David, we left off talking about my specialty, surgery, near and dear to my heart. But as we kick off the second part of our talk, can you chat briefly about care standardization and AI?
Yeah, so under care standardization, this is an example where there are guidelines, everything from cancer care to
vaccine administration to antibiotic administration.
Exactly, antibiotic administration to diabetic care to managing heart failure. And these are best practices that are coming, that are guided both by previous clinical studies and by physicians groups coming together to discuss, what would be the best practice. But the challenge is that we're so often not following these best practices. And so if we could quickly identify patients that are not following the current best practices, then it would provide an opportunity for standardizing care, both at the population health level, but also at the point of care, that we think would be tremendously impactful. And yet again, there's a huge chart review problem because it's seldom the case that there's always the one single right decision. Usually there are lots of subtleties, whether they be contraindications, or past medical history that might prevent a patient from taking one treatment versus another. And so if you want to surface the actual deviations from care, you have to take all of those exceptions into consideration as well. And that's a very complex chart review problem, which again, we can automate.
Well, I mean, this is incredible. I certainly appreciate the work that you guys are doing. Those are three seismic areas in healthcare where, just a small marginal improvement in quality improvement, routing patients or delivering, information to where the patient should be best treated, whether it be an outpatient, surgical center, at home. And then, of course, standardization for, as you mentioned, making sure the patient's getting the best care of those guidelines that are the best practices for that condition. That's amazing. I mean, if you think a lot about where those opportunities are to improve care, those are definitely the areas of the places where a needle can be moved seismically. So that's great. So I just shift a little bit and talk about more the global healthcare ecosystem. I had the fortune of being on the Strategic Planning Committee for the National Academy of Medicine Strategic Plan for 2024 to 2028. And the vision for the National Academy of Medicine and for, their vision for healthcare and writ large now is health for everyone, everywhere. Health for everyone, everywhere. Now, that's a very lofty vision, as visions should be, right? You want to have a bold vision when you're an organization like the NAM, for sure. When you think about that, and you think about, equity, safety, and addressing the ethical considerations that have largely percolated to the discussion of AI, particularly when it comes to health. Where do you see some of those considerations coming into place? And not necessarily for Lair Health, although you can certainly use any examples of how you guys are addressing that concern. But when you think about how we're going to advance AI in healthcare moving forward, how do we ensure that it is safe, that it's equitable, and that we're sort of layering, to no pun intended, layering ethics or operationalizing ethics into everything that we do? Another easy question. See, I told you this would be enough.
This is great. These are good questions. So on the safety side, I'll just touch on that briefly because it actually underpins a lot of what we've been talking about up until now. I think safety necessitates validation, and validation which goes end to end, not just stopping at a metric of AI performance on a data set, but actually going all the way to looking at patient outcomes as impacted by AI in the loop somewhere, and looking at AI in the workflow of the clinician who's using it. Where I'd like to spend much more time is on the equitable story. And I think part of what is going to really help with some of these questions of how do we get AI into the hands of everyone who can really benefit from AI from the healthcare perspective. I think that for that, we have to go well beyond thinking about AI as being integrated into the healthcare delivery system and start thinking about AI as directly augmenting patients directly themselves. And so for this, I'll talk not about my work at Layer Health, but about some of the work that we've been doing at MIT. I've been excited for a long time, as I have many of my colleagues at MIT and at other places in academia, about the idea of, well, if patients could have access to their electronic medical records, which today they can, and that's a big part of what's changed in the US over the last couple of years. How could we help patients better understand what's going on with their health in a way that helps them become much more proactive, in a way that helps them identify what resources would help improve their care as much as possible? And this is a big part of what I think is going to lead to more equitable healthcare in the US, because today, those of us who have friends and family who are physicians or live in an academic environment or have the money to pay for the right resources have a leg up, and that's not fair. So how can we start to even that playing field? Right? I think information is going to be a big part of that. So one of the studies that we've been doing recently at MIT has been looking at how can we take the clinical notes that physicians are writing, the same clinical notes that Layer Health has been working with for all the use cases we were talking about earlier. But now how can we take those notes and help patients better understand them? And the example here is, let's say you are a patient recently diagnosed with breast cancer. You go to meet with your oncologist for the first time. You come home and you might wonder, what the heck just happened? What was my diagnosis? What's my prognosis? What am I supposed to follow up with next? What were my options and why were those my options? Often patients come to health visits with a family member or some other caregiver who can really help them with documenting information during the visit, but not everyone has that benefit. So what we did recently, and this also will get at a safety question, is a study where we used a large language model. In this case, we used GPT-4 from OpenAI to within a patient-facing application to help patients better understand their notes along 4 axes. One was to help translate the note into consumer vocabulary. So instead of doctor speak, language that all of us can understand, all of us meeting me, the non-clinicians in the room. Number 2, helping define certain terms. So identifying words that might be quite technical and just helping really clarify what those mean. Number 3, automatically generating questions and answers. So these are questions that you might have after reading this note, having come from your visit, and here are the answers to those questions. And then number 4 is coming out with a bulleted list of follow-ups. This is what you are supposed to be doing next after the visit. So we used large language models to do all 4 of these. And then we did a study first with 200 healthy women who did not have breast cancer, but who were representative of the population who might be newly diagnosed with breast cancer, and de-identified clinical notes that had been donated by previous breast cancer survivors, and some synthetically created clinical notes. And we did a study where we showed them first the notes and then the notes plus each of these 4 interventions that I alluded to. And then we asked a number of follow-up questions to try to simulate how well they were able to understand the notes in terms of how it would impact various decisions that they would have to make in the near future had they been newly diagnosed with breast cancer. And we found a significant improvement in that follow-up understanding based on using the large language models versus not using it. So that was the first part of the study. This gets at the very, very first step along the safety front of, right, how do you see is AI safe? And in this case, we're doing it with healthy patients because of course there's a whole lot of stress that would surround these interventions for patients who might have been newly diagnosed. And so this is step zero in what I think is a AI development pipeline. The second step we did is we took a small number, something a bit under 10 women who had breast cancer, and we now did this study with them. And all of this was done under IRB, or Institute Review Board review from MIT. We had oncologists who listened on to each one of these phone calls, in addition to reviewing the material beforehand to make sure that the AI that we were using was not presenting incorrect information in order to answer any questions that patients might have had during the call, and so on. So this is part of that safe development process that I think is so important. We had these women who had previously had breast cancer give their clinical notes from their early stages of their breast cancer. And we ran them through our system. And then we did an interview with them where first we showed them their notes just by itself. And we asked them, well, tell us a bit about the questions you had when you came home from this visit. And what did you do? And so they would walk through some of their questions about their diagnosis. They would walk through all the Googling that they did to try to understand their next steps. And then after asking those questions, we then told them, okay, now click this button. They clicked a button on the platform and it showed them the automatically generated questions and answers. It showed them the follow-up items that are going to output. And then we reflected on what they had said their challenges were and what just showed up at that moment when they used the system. And you could see these patients' eyes light up. One woman said that she had never understood her diagnosis until that moment. Another woman said that this would have substantially reduced the stress of the moment because it helped introduce the information in a way which was much more calming. It didn't have her Googling around to sites where she didn't know whether the information was relevant to her case or not. And another patient mentioned how it would also raise new questions for them about whether the AI was correct or not, and how there might be new stressors that are involved if the AI were to bring up information that they hadn't thought about before. So again, this is all part of that development cycle, and this and things like it could be hugely impactful from an equitable perspective of how we can use AI to really improve healthcare for everyone, everywhere. But then secondly, I think it's an example of really baby steps for what it means for AI safety and development, and something that I'd like to see both academics and companies who are working in this space start to replicate.
Yeah, well, this is fascinating, and that's an outstanding example. And what you said is so prescient because I can tell you, not necessarily over breast cancer diagnosis, although I did that when I was a general surgeon, but in my thoracic surgery experience, we have to give bad news sometimes to patients that are often very stressed out and very confused and a little disillusioned by what we're saying, and I try and make my, communication as simple as possible, but it's in the moment that patient is now receiving, life-changing news about lung cancer or, heart disease or something that, they weren't expecting. And to be able to take that, like you said, and have it be equitable now with a platform that can ingest their information, my notes, my colleagues' notes, everything in their chart and their record, and then generate something that's going to give them insight, by translating, my doctor speak into something simple, defining what the diagnosis really is in layman's terms and simple to understand terms, and then give them the questions and the answers. Very, very, very comforting. And then, of course, very important to follow-ups because we lose patients to follow-up sometimes, even with important diagnosis like cancer. Because patients sometimes are confused, they're not sure what next needs to be done, or that wasn't very, very well articulated to them. So that's just amazing. And you answered a question that I was going to ask you. I said, how can academia, industry, and sort of folks that are developing this technology work together? And this is a perfect example of that. So in the remaining time we do have, I know that we talked about a lot of the challenges. We certainly got to understand and appreciate a lot about Layer Health and the wonderful work that you guys are doing, the impactful and very relevant research you're doing now. What gives you optimism and hope for the future of AI in healthcare?
That there's a will among academics, among industry, among health systems, among government, and among patients to take these wonderful advances that we've had in technology in the recent years and to really start to experiment in ways that might be a little bit scary because they do challenge the status quo, that need to be done carefully, thoughtfully, and safely. But the fact that I think there's a will now to actually do it means that we can start to dream as a society about not what healthcare is like today, but what it could be like tomorrow.
Yeah, that is very optimistic. Well, what advice would you give for those that are listening and understanding our audience are, academics, they're technologists, they're CEOs of health organizations, and they're just lay people that are, just a patient or just someone that engages with health, and they're curious about how is AI going to impact my life? And you touched upon a lot of that, but if you were to give some parting advice to a broad swath of the community that are folks listening and interested in AI and healthcare, what advice would you give them?
That's a hard question. Because it's different advice for each person.
Sure. Well, this is the podcast of easy questions.
So I'd say for health systems, we need to be thinking a bit long term about what a common approach could be like. So they're going to be inundated by AI companies who are coming in with point solutions saying we can use AI to solve this, to solve that, and so on. And obviously, I'm speaking biased, coming from Layer Health's perspective. We're aiming to really provide a broad capability that will tackle many of these different needs, not that you would otherwise be tackling like point solutions. But I think that perspective, that platform perspective, is going to become really important because these questions of how do you get scalability is going to become essential. And it's going to be what's going to really enable us to have the impact. Because, for example, some of the problems that I mentioned don't have a big enough ROI associated to them to actually incentivize a hospital-wide. And so we need to be able to find those use cases, some of which I did mention, that do have a big ROI associated to them, use those to really get the platform into place that we could then start to tackle the ones which are really impactful from a patient and provider perspective, but perhaps don't have the dollars around them.
That's great. You talked about, how the patients could benefit for sure. I think the concept of shifting the equity and the power to the patient because of information and because of the democratization, if you will, of AI is powerful. And I think it speaks volumes for equity. And of course, I think the things that you highlight as Layer Health's being the vanguard for all of the work that you're doing is very exemplary for those that are in the tech space looking to look for a good model. I think yours is outstanding.
I really appreciate the opportunity to be here. And I just wanted to mention before you close out that I will be listening on to all of your future episodes.
Oh, I appreciate that so much. Thank you so much. Well, David, thank you so much for spending the time with us and for sharing the great work that you're doing, not only in your academic and MIT and academic, world, but the outstanding work you're doing at Layer Health and being an example for anybody looking to enter into this space or it's working in this space and wants to look at a good example of a company doing it right. And thank you for the really powerful message that I think you shared with all of us and particularly those that are going to be patients or are patients now about how they can look at AI not as something to be scared of, but a tool that can actually help provide a lot more equity and empower them to be better stewards of their health and healthcare. I think that's a really important message. So I can't thank you enough. I really appreciate your time, your insight, and certainly your perspective. And want to thank you on behalf of all those that are going to benefit from your great work for all that you do.
Appreciate it.
And that will do it for another episode of Smarter Healthcare with AI. Please make sure to leave a 5-star review on Apple or Spotify, and don't forget to hit subscribe so you won't miss any future episodes. Thanks again for listening, and I'll see you next time.
This has been Smarter Healthcare with AI. If you'd like to find out how to bridge the gap between medical experts and tech innovators and discover how AI can make us healthier and more human, go to Tetteh.com. Smarter Healthcare with AI with Dr. Hassan Tetteh is a production of Forbes Books.